Anything to add, Kelly or Dr. Olive, about, setting expectations, maybe even nutrition? What framework is kind of governing how you're handling that when people come to you?
I think I think nutrition is actually something that's lacking in a lot of practices. A lot of the places people are getting these medications from are, big telehealth companies, weight loss clinics. There's a lot of variety in sort of how things are set up. And by and large, people do not get any recommendations. We hear from people, they handed me the medicine and said, maybe eat healthy or something very generic and small, without much description of what that means. And it's really important to, I'm going to disagree a little bit here, but focusing on what you're eating is really important on these medications because you're not eating a ton. Your portions are all small. And so you need to make sure you're getting in all of the nutrients that you need in those smaller portions. And protein, especially, is just so important while you're on a GLP-1 because we've all heard about Ozempic, but people, are losing weight, but they're not necessarily looking the way that they want to look. They are a little bit saggy. They're not toned. And if you're not eating adequate protein and doing strength training along with it, that's going to be what you see. So we really do work on emphasizing protein, getting up slowly to where you need to be because a lot of people are eating, 50, 60 grams of protein a day, and that's just not going to cut it to help prevent the muscle loss that people see on the medication.
What's your general recommendation for protein intake on your clients?
We go for, it's hard because a lot of these people are very overweight and even their goal weight is pretty high. In general, it would be about 0.8 grams per pound of ideal body weight or their goal body weight, but we often have to go a little bit lower because if they're just trying to get down to 200 pounds, that math is going to be really difficult to get in that much protein. So we usually max around 140 grams a day.
That makes sense. Interestingly, there's only one study that's been done in the world on moderate calorie restriction in someone who is technically like a normal weight. It was the calorie study that was out of the NIH, and the first pieces were published in like 2018, 2019. And they must have been all hospital workers because the first 30 days they were observed everything that they were eating, and they followed this group very intensively. But it was done in a really great NIH fashion. And they were able to actually get muscle biopsies on them. And what they've found is that there's, when you're on just a moderate calorie restricted diet, that internally your body sets off a number of molecular mechanisms that actually help to preserve some of the lean muscle mass, which is completely different from someone who's doing extreme dieting, like someone who's a wrestler or a fighter or someone who's a jockey. And so I think that it's hard for people to really starve themselves. And so just having that moderate calorie restriction is actually setting off some mechanisms that are going to preserve some of the lean muscle mass too. Of course, you actually have to be well nourished and do your regular, exercise and so forth. But I think that was a really interesting observation that is applicable for the GLP-1 medications.